Hi, Paul Sakis, Good News Planet. I'm here with Marta Korytkowska. Hi, how are you?
Good. How are you this morning, Paul?
I'm good. I'm very good. So we're going to talk about, because I don't have alopecia. How do you say that? Aphasia.
Aphasia.
Aphasia. Okay. So this is a serious subject. And we're going to talk about, well, Bruce Willis came out and said something about that. And a bunch of my friends know Bruce personally. And so to hear that, I guess the brave outreach that he's going to take some time off to deal with this. You're a clinical assistant professor at the College of Health Professionals at a great school that I happen to know a bit about, Sacred Heart University up in Fairfield University. I went to Fairfield University for my grad school. So it's my local area and in Quinnipiac, so undergraduate. So Connecticut is a good place, and Sacred Heart has always had a great reputation, especially in the world of medicine and health. And so on, it's one of the fastest growing schools in the whole country, I believe. Good Catholic university. So my name's Reverend Paul Slakis, actually. And so let's talk about this because there's a couple other words I don't understand here. You conduct research in lexical retrieval in healthy individuals and those with brain injury, specifically aphasia. Aphasia?
Aphasia.
Aphasia. Okay. I did do the brain series on PBS, but I still could never hardly say the words. That's why I'm in communications and not a doctor. All righty. Tell us about what we're talking about today, please.
Yeah, so I think aphasia is a really broad term, and whenever somebody who's in the light or in the media becomes public about something and shares about some information about a diagnosis, we bring information to that diagnosis to the general public. And I think that is what's so great about Bruce Willis and his family being public about what is happening. I would caution us not to speculate directly as to what's happening to Bruce Willis, as aphasia is such a broad term. I think speaking very generally, aphasia is defined as a loss or a difficulty of language or with language, but it does not impact cognition, and it does not impact intelligence or thinking. It's simply a difficulty with finding the right words, forming sentences, but also understanding information as it's coming at you, because now you have to decode those words and those sentences.
So how does somebody know that they have this? They're in a conversation and they can't kind of recollect. I can't remember the word conversation. Is that what would happen? I would be speaking with you, and all of a sudden, it's not Alzheimer's, right? Or is it a lead to Alzheimer's?
No. So I think etiology is important here. A lot of the times, or what we most traditionally think of when we think of aphasia, is we think of having a stroke or a traumatic brain injury. There's been other famous people who have talked about their aphasias. Emilia Clarke from Game of Thrones had an aphasia while filming. I believe she had an aneurysm that burst or something along those lines. So she had a brain injury. Gabby Giffords, the congresswoman, she suffered a gunshot wound to the head and had aphasia. So normally something happens, and typically it's a stroke or a traumatic brain injury or a fall. There's damage to your brain, specifically on the left side to the language areas within your brain.
Uh-huh.
However, aphasia can also be a symptom of other things. So there's something called primary progressive aphasia, which is under the category of dementia. It happens because of progressive disease. And, just like dementia, would you start to notice some symptoms of language? And the first symptoms that you notice are language symptoms. They're not forgetting your keys or not understanding information or getting lost. It's having trouble getting the words out and having conversations with people and understanding information. Because of brain atrophy, because of a progressive type process. So there's different etiologies. And I think people might start to panic sometimes, like, oh, I'm having trouble finding the name of this place or this person. And And I think it's important to note that we all have those moments of tip of the tongue responses, especially as we're getting older, and those are normal. Those are typical. So we've all had that moment like, oh, hand me that thing, you know, that thing that you talk on, right? But that doesn't,
I think I started off that interview this way.
but that doesn't mean we have aphasia. That's just, you know, we're not 100% great at everything every single time, you know?
Well, you know, since I'm sort of like a little older, I think we call them senior moments. So is aphasia senior moments?
Nope, aphasia isn't senior moments. So, or how we're defining senior moments here. It is true that we have more difficulty with finding the right words as we get older, specifically proper nouns, names of people, name of places. But there's a normal variation there, right? I mean, I experience it when I get tired, for example, or when there's a lot happening. Even as we're talking, you'll hear me pause and say or and I'm looking for the next word. And so that's completely within the normal limits. It's when these language impairments or these moments of having trouble finding the right words, they start to interfere with our daily lives, with our ability to work, with our ability to communicate with people, with our ability to read, maybe. So it's when these typical things actually start to expand and just be more.
It's a serious issue. I'm not going to like fool around and say like, you know, I couldn't remember people's names when I was about 7, starting then. No, but,
The proper nouns are the hardest, right? So it also depends on the
really?
category of the word. Yeah, proper nouns are the hardest. So there's
Wow.
actually been studies done that it's easier to remember that somebody is a baker, right? So if you told me, oh, I'm a baker, I might remember that. I might associate with you, oh, that's the baker, versus if you told me that your last name was Mr. Baker, I would have a much harder time recalling that.
I'm great with last names. I'm better with last names, and I'm better with baker. I'm 100% better with knowing they're a baker.
Yeah, and that there's been studies done on that. So that's kind of been shown in the literature.
So I have to say, you know, I know you're a baker, but what's your name? No. All right. So,
Yeah.
so let's, in all seriousness. So how do we, as I mentioned, I did worked on 2 years of my life on the brain series, okay, on PBS 82, the first big science series. And one of the things that we used was this thing that was just starting almost a little bit. So the PET scan. And we would put somebody under there when we do winter depressive. We'd show them how the hypothalamus would change, you know, movement in the brain and other concerning brain conditions.
Mhm.
How do they know? What do they do now? Do they put Bruce Willis under PET scan?
Yeah, so now, assuming that there was no incident that triggered this, right? That making the big assumption that there was no traumatic brain injury, that there was no stroke or brain bleed or anything like that. If doctors are concerned of the symptom of aphasia, what they would do, a neurologist would recommend a CT scan of the brain, an MRI of the brain, and they would look to see where the atrophy is. And the scans from the CT or the MRI combined with language testing, usually done by a speech language pathologist, would help diagnose what is happening. So a doctor might diagnose with what is causing the aphasia, and then a speech language pathologist would help diagnose what type of aphasia it is.
Okay, so you know we're good news here, broadcast and planet and so on. So positiveness. So you know it's always you know sometimes the bad news. Now we got to hear the good news. So what are some of the kinds of things that let's say Bruce can do now? I mean, when he's taking some time off in his life, maybe I don't know, meditating, yoga, or what, or food. You know, I always ask all the doctors, you know, should I eat something different, especially if they're, you know, these 100+ age people, studiers. What positive things have we, after this time of understanding this concerning disease? I'm going to call it a disease. I don't know whether that's the right word. What are some things that people can do to maybe improve themselves?
Yep. So I think that if an individual has the symptoms of aphasia and has been diagnosed with for example, primary progressive aphasia or an aphasia post-stroke, either one, it's important to get intervention early. So in something like a progressive disease, things are going to get worse. So the earlier that you could get help from a speech language pathologist specifically, the longer you can retain what you have, or maybe even improve on it. There are some studies that have shown that, hey, if you are having trouble with aphasia due to primary progressive aphasia and you start therapy early, we can actually help you get a little bit better, sort of maybe closer to where you were. And that doesn't mean it's not going to decline. It certainly will, which is the opposite of good news. But you can try to maintain for as long as you can by doing therapy, by keeping active in your language, by using your language. You know, we all have heard the term, if you don't use it, you lose it. And, you know, that also goes towards language, and practicing and working on specific techniques and reading and active use, right? So the TV is very passive, but a conversation or reading something like, you know, The Economist or you know, some other newspaper that has a lot of heavy language, dense language, is going to involve more parts of your brain and work a little harder.
That's what they taught me at Fairfield University, masters in communications. You know, that TV, Marshall McLuhan, it's the medium is the message. That's exactly what they taught me. And, you know, you just sit there, you watch the boob tube, and you become a boob. Wait a second, I'm doing TV shows 50 years.
Oh, man.
So, but the point, I agree with you, you know, you need to keep an active brain. So will they, a pathologist, say, you know, look at what kind of they put cards in front of you and say, Mr. Brown, Mr. Brown, Mr. Brown, or whatever it is. And then they come back in a week from now and they show you the same card and they say, who's this? What do they do?
Yeah, so in terms of treatment, in terms of what sessions look like, it's going to depend on the type of aphasia that you have, what your symptoms are. If your symptoms are having trouble with grammar, that's going to be, and producing a sentence and producing tense, then we're going to be working on that. We're going to be practicing sentences. A speech pathologist isn't necessarily looking at, is your language impaired, but it's what part of language is impaired and why that part of language is impaired, right? So if you're having trouble finding the right words, is it the sounds that you're having trouble recalling, the syllables, the structure of the word, or is it the definition of the word, the information behind that word? And we're going to take an approach that's going to try to pull that information out. So we're going to do a lot of drill practice, a lot of conversation therapy, a lot of compensatory strategies, maybe introduce an alternative augmentative communication device. So something where you can press buttons eventually if your language will be really poor and the device can speak for you so you can make your needs known. We have a lot of different approaches we can take. And I think most importantly, it's education, understanding what's happening to you and understanding that it's just not impacting the person with the diagnosis or the symptoms, but rather the whole family and all those communication partners. So really educating people on how to repair communication breakdowns and how to help when somebody's having trouble getting the words out. I think the worst thing that we can do is guess, right? If you're having trouble getting the word out, is to guess. Oh, you mean to say, oh, do you want this? Oh, do you want? No, give that person extra time and empower them to try to get as much language out as possible.
So in essence, be patient with each other.
Yeah. Yeah.
And not everybody speaks at the same pace. And sometimes people do need to take a moment to think about what they do want to say. You can't get it all together to get it out clearly. Be kinder, more gentle to each other. We like these kind of words.
Oh, I think it's, you know, it's all those things our moms told us, right? When we were little, but now it's on a bigger scale, and it's understanding how to apply that with somebody who's going through something and really understands what they're going through. They know what they're going through. Their cognition, their thought process, it's there. It's just a matter of getting the thought from your brain out to the person to hear you.
Wowie. Listen, Marta, I want to say that, you know, first, everybody should look at Marta's resume. Actually, I have your background on. We're going to promote that. And I actually feel in better hands right here, right now, knowing that someone like you is getting first a PhD, but not first PhD, is doing what she's doing. You know, you're the I'm going to have to say, I'm starting to feel older. I don't know why. The next generation, my daughter's age. Okay. So, but you're a smart one. You really have a lot of experience and you're working hard because you love what you're doing. Am I right here?
Yeah, and I think that that's the big, so thank you for all those kind things, first of all, but second of all, I think that that's common in the field of speech pathology. We do this because we love it and we love working with people. You know, some of my students are second career who come from, you know, business or law, and they come to do this career because they want to help people ultimately. So this is definitely a population of individuals who are in it to help with communication and to help everything that they can, you know, it's the passion is really there, the heart.
They're in it to win it.
In it to win it.
Hey, I'm a marketing person. All right, last question, Marta, and thank you very much. Thank you, Sacred Heart, for sharing you with us. And we're involved with World Peace, the International Day of Peace, and doing lots of events for many years. Actually, I actually made the first TV show at Fairfield University on a magician many years ago. But we like this communication stuff but I like the events because the events are more interactive than passive TV. But with these events, so I ask many people, what does peace mean to them? Marta, what is peace for you? What's peace for you?
Oh, wow. I think that that's a great question. I think you mentioned that I'm of Polish descent when we first started chatting with each other. And we know what's happening in that portion of the world right now. And I think that peace to me is the opposite in what I mean by that is being there for others, right? And understanding that we all want the same things. We just want to live with each other and get along and be kind. And sometimes we can't be the best versions of ourselves, but what's happening in Poland and across Europe and taking in individuals from, you know, war-torn parts of the world, or I think that that's beautiful. And I think that that's part of peace, some light in a time of darkness.
All right, Marta, you're fantastic. Thank you so much.
Thank you. Have a great day.
You too.